I'm Anna. I'm a 28-year-old physician assistant. I work for a plastic surgeon in San Antonio, Texas. I've been a PA for 3 years. I really enjoy my work. What I do for fun is I hang out with my husband. We've been married for 8 months. I started considering breast augmentation after I had already started working for my surgeon. I never thought I would want to do the procedure, but as I started seeing more and more women and how happy they were with their procedure, I kind of got a different idea of what was possible. The look that I was going for was something that was very proportional to my body. I don't have a lot of curves, so I wasn't looking for something too large. So I wanted to get something that really just had a little more fullness on top, but still matched my proportions well. I wanted to know the difference between brands, but the only brand that we carry is Natrelle. And when I asked my surgeon about why, he told me his reasoning, but I did my own research as well. I loved how soft they were, how they had really great science behind them, and I was really excited to have something like that as an option. When I sat down to have my official consultation with my surgeon, after we went over all the risks and complications that could happen, we went over all of my options for sizing, what my goals were, and he was very open and honest about what he could achieve and what he thought would be a good idea. So to try and see what the new look would be like, which I would have to say was probably the hardest thing from going from what I have, I was a little nervous, so we used sizers. He measured me, and based off my width, he told me what I could go with, and we went with a lower projection, which I'm super happy I went with a lower projection, because even though it's a smaller implant, I feel like it looks really proportional on me. We used an electronic imaging system where we took a picture of my body that's integrated with all of Natrelle's implants, and I got to see what my own body would look like. And you know, I went with the smallest to the largest because it was just interesting to see. My surgeon had 3 options for me, and I got to feel all of them to figure out which I felt would be the most realistic feeling, and I really liked to feel the differences between them, and I chose the one that I felt like would be the most realistic in me. I feel like my surgeon did a really great job of giving me all of the information that I needed, answering all of my questions. We went over risks, complications, anything that could happen during the procedure and after. So I had a really good understanding of what was going to happen going into it. My surgeon goes over a full checklist to make sure that I am well informed and that I had a good idea of everything that was going to happen and that I felt comfortable with everything.
Natrelle breast implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.